I got instruments clean. They're Hi everyone, my name is Rita, also known as Rita Halad. I'm a registered dental hygienist and I practice as a dental hygienist. So today I'm here to talk about what to expect when you come to a dental practice to see a dental hygienist, what you should see, what should happen, and just to reassure you that everything should be okay. You shouldn't be scared of your dental hygienist. For all of you that are new here, you're welcome. For those of you that have seen me before, thank you for watching, thank you for tuning in, and keep coming, keep watching, keep supporting. Anyway, when you come to a dental practice, obviously you'll be welcomed by a receptionist. You walk in, they talk to you, they get you to fill out a medical history form. Yes, we always get you to fill out a medical history form. The reason why you fill in a medical history form is to update us on what's going on, just in case of a medical emergency. You never know, anything could happen. Hey, such is life. Oh, sometimes we have to look at what we're using just in case it's got implication to your medication or to your health condition. So that's that. So when you come into the room to see a dental hygienist, there is quite a few things we start with. We will introduce ourselves, explain to you what's going to happen, and we talk through your oral hygiene, go through what you normally do, what your routine is at home, and then we get started. We do use quite a few instruments, so don't be freaked out whenever you come in and they're like, oh gosh, I see lights, I see this, I see that. Don't be freaked out, it's totally fine. So we use quite a few instruments. For example, I'll show you some of the instruments we use. We use something like that. That's a dental mirror. You use it in the mouth to sort of see what's going on, see what you're doing, if you can see. Oh, look, you can actually see me through my mirror. Look at that. Yay, see me recording. Yay. So yeah, we use the dental mirror to see what's going on in the mouth. We also use something called a probe. There are different types of probes. For now, I'll show you this one. If you look closely, I'll bring it forward. I don't know if you can see it. Let's see. If I do that, can you see it? Now let me use the back of my hand. It's got lines on it. Yeah, so those lines on there show us if you've got gum disease. There's a video up there, it's a bit disgusting, but anyway, if you look at that video, look how deep I'm going in. That sort of shows me the extent of the disease or the problem. So we use this. Sometimes it's a bit uncomfortable when we sort of press it into the gum, but we can't help it because it sort of guides us on what to do or what's going on. It shows the state of gum disease. So this probe is super important. So after using the probe, we'll sort of explain to you what's going on. If you've got gum disease, the state of your mouth, if you've got stains, if you've got any problem, we sort of explain it to you at that point. We then get started with the cleaning. Right, so when we're cleaning, we use quite a few instruments, right? They look very sharp, and some people, when they come in, they just feel a bit uncomfortable and scared. They're like, oh my God, I don't like the look of instruments. I hate the sound of it. I hate this, I hate that. But it's part of it's part of it. There's nothing we can do. So we can use that. That is called a hand scaler. Right, it's called a sickle scaler really. So we use that to pick out any tartar, any plaque in between your teeth. Pretty easy to use. Obviously not for you, but for us, because we trained to use it properly. So yeah, we use that, and then we use something called an ultrasonic scaler. It looks like this. Let me take it out so you can see. It's something like that. So an ultrasonic scaler is used to get rid of the tartar. So we would screw it on there. Mind you, when you come to the dentist, don't worry about hygiene, because what happens is for every patient, we've got a new pack of instruments. So we set the packs up prior. We autoclave them. They're always nice and clean. I noticed that some people will come in and they'll be like, I got instruments clean. They're like scared to even say it. But I mean, obviously we would never use instruments that have been used on someone else that are dirty. So we always make sure everything is nice and clean. So this is an ultrasonic scaler. We use that to sort of break off the tartar. So once you tap it on the tooth, it sort of makes a lot of noise. It makes a squeaky noise and it takes the tartar off the teeth. The issue with these is that they can make your teeth feel a little bit sensitive because they gush out a lot of water, and when they gush out the water, the spray can be, the water is cold, right? And that is metal. Sometimes when metal touches a sensitive tooth, it feels even more sensitive. That's why some people end up going, oh, the hygienist caused me a lot of pain. Oh, I don't like going to the hygienist because they hurt me. We don't hurt you on purpose. It's just that where your gums are inflamed and the tartar is right on the gum margin, once you use this to get rid of it, it just sort of causes a bit of discomfort. But you know what? If at all it's uncomfortable for you, guys, feel free. I mean, talk to the clinician looking after you. Tell them that it's hurting. Put your hand up and stop them if you think it's really uncomfortable, because we don't want to hurt you. That's the truth. We don't want to hurt you, but sometimes the state of the gum sort of causes the pain, or I mean, we're human as well. And the trouble is, we can't feel what you feel. That's why I say, if you've got pain, talk to the person looking after you. Like, stop them and tell them, listen, it's really painful. So anyway, that's one thing done. The next thing I will talk about is these. These are sort of like motors. You use them to polish teeth. So what we do is, still single use, we get a polishing brush which looks like that, put it in there, and then we use it to polish your teeth. To me, it is sort of like a big electric toothbrush. That's how I look at it. It's like a massive electric toothbrush. It's not even that massive, but it feels like a massive one when it's in the mouth, because it's quite big in the mouth. So yeah, it's like an electric toothbrush. Very easy. This is not painful, unless there's a little bit of pressure sometimes that could cause a bit of pain, but this is not painful. So those are the main things we use. Sometimes when we're cleaning in between your teeth, we use things like TP brushes. TP brushes come in different colors. I think I've mentioned them before, or you've seen them on my page. I'm going to show you quite a few. These are called TP brushes. If you look, we've got purple there, we've got a red one, we got yellow, we got green, we got blue, we got orange, we got pink, we got all sorts of colors. They color coded according to sizes. I say TP because that's the main one I use, but there's quite a few brands out there, so you could go for a brand that's perfect for you, or what's been recommended by your dentist or dental hygienist. Also, you could use these flossets to clean in between your teeth. Yeah, these are good as well. They're not as good as the TP, but they do the job. So if I'm giving oral instructions, I mean, I sort of tailor treatment to every single person. So yeah, I use these myself sometimes, but I prefer the TP. I tell you why. It's because when I go in, it feels like I'm proper cleaning my teeth. It doesn't feel like, basically, there's no technique to it. It's easier, and you feel all the food and debris coming out. I'll show you how it works actually. I've shown you before, but I'll still show you. What I do, I put it at the back, bend it a little bit, and go in between my teeth like that. I just had my lunch, so yeah, I see some. It's tight there. Like, yeah, like that. It's easy. I wiggle it in there. Sorry, I'm on camera, so it's a bit tricky. Yeah, like that. So these are TP brushes. This is orange. It's the color that fits in between my teeth. But where it's tight, I use the floss. I'll put that in the bin. So yeah, they are reusable, by the way, but I'll put that in the bin because I don't need it. So yeah, guys, don't forget to subscribe. Subscribe, guys, subscribe, refer a friend. But yeah, those are the main things we use at the dental practice as a dental hygienist. Sometimes if you need a lot of treatment, we can go into numbing you up, giving you injections to numb up the gums and carry out the treatment. That's if you've got severe gum disease or anything like that. And sometimes what can we do? Yeah, if at all the treatment needs a lot more attention, we could refer you to a gum specialist and they can carry out the treatment for you. But that's another topic for another day, because it could be a lot of work. So other than that, I think those are the main things we use. We could give you a cup of water or mouthwash to rinse out. But guys, what I'll emphasize is, if you ever go to a dentist and you're nervous, that's the first thing you say. Tell the person looking after you, I'm a bit nervous, could you be gentle with me? I mean, I'm not comfortable, I don't like it at the dentist. Communicate, tell them how you feel, because if you tell them how you feel, it makes the whole experience a lot better for both yourself and the person looking after you. If you've got any questions, guys, don't be shy, just ask me. Put a comment down there, put a comment, and yeah, we should be okay. So yeah, anyway, thank you so much for watching, thank you for tuning in. Anything you want to ask, feel free, and see you later.